Hi everyone, welcome back to YouTube channel. Today we are going to talk about mandible, and at the side you can see the diagrammatic representation of mandible showing different parts and features of mandible. We'll start our topic with introduction. Mandible is called critical component of craniofacial skeleton, serving as the foundation of the lower facial skeleton. Besides housing the lower dentition, it is pivotal in enabling mastication, facilitating speech, and influencing facial appearance. Due to its complex morphology, the mandible provides both mesenchymal efficiency and aesthetic value. As such, as in-depth understanding of structure, growth pattern, and clinical relevance is indispensable for effective diagnosis, treatment planning, and reconstructive efforts. Now let's talk about structures and components of the mandible. Mandible is U-shaped bone comprising several regions that work together to support oral function. The first region of it is body, that is the horizontal portion of the mandible that forms the chin and houses the lower teeth. The alveolar process along the superior margin contains the tooth socket that are dental alveoli that are essential for dental occlusion. Second part is ramus, that is the vertical extension on either side of the body terminating into the two key processes, and these two key processes are condylar process and coronoid process. Condylar process, that is the posterior projection that articulates with the temporal bone at the temporomandibular joint. This articulation is crucial for jaw movement, including opening and closing of the mouth. Second vertical extension of ramus is coronoid process, that is the anterior projection where the temporalis muscle attaches, contributing to the forceful elevation of the mandible during chewing. Further talking about structure and component, it has angle of mandible, that is the junction where the body meets at the ramus. This region marks a transition from the curved anterior structure to the vertical ramus and often serve as an important landmark during surgical procedure. Next we have is mantle foramen, that is typically found on the interior surface of body. These openings allow passage of the mantle nerve and blood vessels, serving sensing function and providing vascular supply to chin and lower lip. Now let's talk about surface feature of mandible. Mandible surface are characterized by superior alveolar surface. This surface bears the socket for the lower teeth and irregular adapter for dental attachment and occlusion. Inferior border than it has, that is a thick smooth ridge that reinforces the mandible structure's integrity. Then it has anterior symphysis, that is the midline fusion point in the front of the mandible where the two halves meet during early development. And the mandibular canal, that is a canal running through the body of mandible that contains the inferior alveolar nerve and blood vessels that are crucial for dental sensation and nutrition of the bone. Now let's talk about development and ossification of mandible. First, we will talk about its embryological development. The mandible forms through the intramembranous ossification, that is a process in which mesenchymal tissue directly differentiate into bone without forming a cartilaginous precursor. During early fetal life, paired mandibular segments fuse at the mandibular symphysis, establishing the basis for lower jaw development. Then we will talk about postnatal growth and maturation. Growth dynamics. The mandible continues to grow and remodel throughout the childhood and adolescence. The growth of the mandible is influenced by genetic factors, functional demands such as mastication and dental eruption pattern. Then talking about suture fusion, the fusion of the mandibular symphysis generally occurs during the first year of life, although the minor remodeling persists into adulthood to accommodate functional stresses. Now let's talk about functional significance of mandible. The first significance is mastication and jaw movement. Articulation and mobility. The mandibular condyle articulation with the temporal bone forms the temporomandibular joint, which allow for a wide range of movements, including rotation and translation. This mobility is essential for chewing, speaking, and expression. Then there is muscle attachment. The mandible serves as an anchorage for multiple muscles, including the masseter, temporalis, and pterygoid muscles. These muscles generate the force required for biting and grinding food. Next functional significance is support for the lower face. Aesthetic contribution. The mandible provides the structural framework for the lower third of the face. It shapes and controls a major determinants of facial appearance and symmetry. Then it has protective function as a robust bone structure. The mandible protects the lower dentition and acts as a barrier against trauma to the deeper soft tissue. Further talking about its functional significance, it has sensory and vascular support. Neural pathways. The inferior alveolar nerve running through the mandibular canal supplies sensation to the teeth, chin, and lower lip, contributing to oral sensory function. Then it has vascular supply that is by the branches of inferior alveolar artery that provide essential blood flow to the mandible, supporting both metabolic need and bone vitality. Further talking about, we will talk about clinical significance of mandible. There are fractures and traumas. Mandibular fractures are among the most common type of facial fracture, often resulting from the direct blows, falls, or motor vehicle accidents. These fractures can affect any region of the mandible, body, ramus, angle, and may require careful assessment through clinical examination and imaging. Treatment modalities varies among the close reduction, that is for non-displaced and minimally displaced fracture. Conservative management may be sufficient. And then there may be in treatment modalities open reduction and internal fixation, that is for complex fractures. Surgical intervention is often necessary to restore proper occlusion and static alignment. Further documents clinical significance, it has temporomandibular joint disorders, that are the dysfunction of TMJ can arise from mandibular malalignment, degenerative changes, or trauma. TMJ may present with pain, restrictive movement, and clicking sound during jaw motion. Comprehensive understanding of mandibular anatomy aids in clinician in diagnosing and managing such conditions through both non-surgical and surgical treatments. Then there is dental and orthodontic consideration of mandible. Dental implantology. Adequate mandibular bone quality and quantity are essential for successful dental implant placement. Orthodontic intervention. Alteration in mandibular growth can influence occlusion and require timely orthodontic treatment to correct malocclusion and ensure balanced facial development. Then it has reconstructive surgery. In cases of tumor resection, severe trauma, or congenital deformities, mandibular reconstruction may be necessary. Surgical reconstruction often involves the use of grafts and relies on precise anatomical knowledge to restore both function and facial aesthetics. Now let's talk about conclusion of all this lecture video. The mandible is a dynamic and multifunctional bone that plays a critical role in mastication, speech, and facial aesthetics. Its intricate structure with distinct anatomical regions such as body, ramus, condylar process, and mental foramen underscore the importance in maintaining oral function and structural integrity. A comprehensive understanding of its development, anatomy, and clinical implication is vital for healthcare professionals, imaging, craniofacial trauma, dental pathology, and reconstructive challenges. And this was all about mandible. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.